Welcome to Southwest Florida Real Estate Update, hosted by area realtor Jim York and York Real Estate Group of Downing Fry Realty. Our show will bring you the most up-to-date information about the local real estate market, featuring leading experts in the real estate field.
Good afternoon and welcome to the Southwest Florida Real Estate Update. I'm Michael York with the York Real Estate Group, and I'm joined today by Jim York and his guest, Dr. Greg Leach, Medical Director of Advanced Medical of Naples.
Well, thank you, Michael, for the introduction. We're here, Dr. Leach, one of my favorite doctors in town. I know this is a little bit different because we do a real estate show here and for our viewers, but I think with all the people that are moving down here and also with all the realtors, we're constantly getting inquiries about doctors in the area. Who should we go to and who could you recommend? So I thought that it would be nice to bring somebody like yourself that's been in town for, what, 20 plus years, and just give them a little background
30.
About 30.
I shouldn't admit 30, but I will.
You don't look that old.
Thank you.
And just give us a little background about yourself, and then maybe we can go into your practice, so just so people can get to know you and maybe want to go see you if they need you.
Well, I'm a family practitioner. I was raised in Florida. I'm a University of Florida Gator graduate. Went there for 8 years, and then after that I went out west for quite a while. I worked for the Navajo Area Indian Health Service, treating Indians for about 4 years. Then I worked for a major health system in the Denver area before coming back to Florida and coming to Naples. So I have an ambulatory family practice, which is what I started. Ambulatory means it's not a hospital. We don't admit people. We see patients. It's just like a traditional family practice, but we also are open 7 days a week. So it's a very extended hours family practice.
And those hours are from when to when?
During the week, it's 8 a.m. to 8 p.m., and on the weekend, it's 9 to 5. So it's primarily an appointment-based practice, but we also see patients who are not our own, so to speak. Patients that need to be seen, people that come in on a walk-in basis, visitors from anywhere, actually. We see those patients as well. So we're busy all the time.
And your offices is located where?
At 720 Goodlet Road North in the Commons. It's right on Goodlet Road. It's a tall building there. You can't miss it.
Right, and it's closer to downtown, or how?
It's seven blocks north of Central Avenue, and it's about 12,000 square feet of practice.
Right.
Yeah.
And for them to make an appointment to come see your office, or for appointment for somebody that's sick, what is your phone number there?
It's 566-7676, and we can be accessed by the internet or phone book or any way.
And your website?
And website, yes, we have a website as well, which is actually, these days, we're seeing more patients access us through the website than through any other method. It's an amazing change over time to see how people come to the doctor.
Right, and then I know obviously I've known you for years, okay, and obviously I go to you and recommended lots of patients for you or clients, but just tell them about your practice, what they can go in there. I know if they have a broken leg, you could go in there.
Well, it's a traditional family practice, which is not really easy to find anymore.
Right.
We see everything from age 0 to geriatrics, infants, adolescents, adults, geriatrics, for whatever they need. And we can take care of greater than 99% of anything that walks in the door by appointment or by walk-in. So we sew up lacerations, we treat, obviously the main body of any practice is internal medicine and family medicine.
Right.
For hypertension, diabetes, hypercholesterolemia, that. But then we all have those things that happen. We get foreign bodies in our eyes, we have lacerations, fractures, So we can treat those, and whatever we need to refer, we do refer, appropriately to someone else. So we
Go ahead. Sorry.
we have the ability. I've always been spoiled, so to speak, because I built my practice so that I would have ancillary services on site. So if somebody comes in and they have a fever and abdominal pain, I want to know what's going on, and I don't want to wait for a lab test or an x-ray across town.
Right.
That's really not an efficient way to treat anybody. So we have x-ray capability on site. We have a full laboratory on site. We also do electrocardiograms. We do bone densities, which is more of a preventative service.
Mm-hmm.
But for the most part, we can narrow down if there's an urgent or semi-emergent issue, problem. We can narrow it down and figure it out.
Right.
Yeah.
And that's where I was leading to. I wanted you to mention about the x-ray machines, and you can go in there and get your lab work right done there, check. So let's just tell us a little bit shortly about the team that you have there, because you have a pretty magnificent team of people.
Well, we have 3 physicians currently, and 5 nurse practitioners. So at any given time, we may have anywhere from 4 to 5 providers working on any given day. On the weekends, we have 2 to 5 providers working. And sometimes my patients come in and surprised how busy we are.
Right.
Like, why are all these people here on the weekend? Well, just like you and me, we work during the week, most of us, and it's most of the patients that I see on the weekend are professionals that just can't take off during the week or choose not to. So that works out well for that.
Okay, well, Dr. Leach, we're going to take a little short break, and we're going to be back in 1 minute.
When picking a realtor, don't just pick anyone. Pick someone with experience. Pick someone with a proven track record. Pick a realtor like Jim York from Downing Fry Realty, the #1 brokerage with the most real estate transactions in the area.
My husband and I had very specific ideas about what we wanted in our new home. Jim York was able to help us find the home that was ideal for us.
With over 20 years of real estate experience in Southwest Florida, Jim York has negotiated over $200 million in sales contracts. Selecting the right realtor is a critical decision that can earn you thousands when selling or save you thousands when buying.
Jim also helped us with a mortgage lender and a good real estate attorney. He went that extra mile, and his experience says it all.
Call Jim York for a no-obligation meeting at 239-273-6727 or visit his website, www.naplesyorkrealestate.com.
Welcome back. Dr. Leach, let's go into how people can access your practice.
Well, as we discussed, we talked about any number of ways to find our practice online or in the phone book. But I think for your clients and people that are new to town,
Right.
people that are shopping for real estate or have already moved here, it's not easy to. Well, first of all, it's just not a natural thing to move a human being from one place on this planet to another.
No, it isn't.
We're so oriented toward where we shop, where's the doctor, where's the dentist, and it's disturbing and very stressful.
Very.
It's one of the most stressful things in life, they say.
Yep.
So finding a physician is not easy. Finding a physician that you click with, that you have a rapport with, is not easy. And right now it's even more difficult because there's a shortage of primary care providers.
Right.
But we have many patients will call the Collier County Medical Society. In fact, that's one of the best ways to find a qualified physician when you move into any county, is just call the medical society. And they will refer you to a member, and they're good at referring to qualified members. That's one way. Word of mouth is still one of the best ways to access physicians. Online, I've still been surprised about how many patients online really spend time trying to figure out who I am, where I came from, what I do, what the practice is like, and make a decision just based on that information, which is always somewhat worrisome because sometimes you might have a bad review for any number of reasons, and there's no such thing as a perfect review all the time. But still, patients can make or appear to be making very good judgment decisions, in my view, when they come to see me. Not because they saw me, but because I ask them how they find out. And many times, for instance, your clients, I will see people who are shopping for real estate. They're in a hotel.
That's right.
They get a referral from a hotel, or from a condominium association, or for they'll be. We also, I mean, we market to hotels and residential communities because we know there's a need there, and we see new patients. I had a lady just a couple of days ago that moved in from moved to Port of the Islands, which is way out, as everybody probably knows, in East Naples, and she came in just by shopping online. She was a savvy internet shopper. So I think there's any number of ways, but I think that still, when you go, you're still going to judge what the kind of quality service you're getting, and that starts as soon as you make the phone call to the office. What kind of response? What are the staff like on the phone? What are they like when you walk in the door? Are they taking care of you? Are they pleasant? Are they listening? And I spend most of our investment in our practice on people, on training people, and teaching people, and training people how to take care of patients, because that's what we do. It's what I do, and I only see patients for a certain period of time. And the other staff who draws the blood or takes the electrocardiogram or the chest X-ray. It's all part of healing and reassurance. So I think that when you go to an office, you can figure it out just by judging. Consumers know what good medicine is.
That's right.
Much is talked about how we can rate quality of. Nobody's been able to figure out how to rate quality of practices. You can put all these numbers on paper, but when you come and see me, and you're in that room, and I'm treating you for an upper respiratory infection, you know what the interchange should be like. You generally know, and you can judge, and most patients judge that way. So it's a process more than a single decision.
No, it certainly is, and it certainly is. And how about insurance? How do you handle payment?
Well, insurance is becoming more of a difficult market with the advent of the Affordable Care Act, or Unaffordable Care Act, depending on who's looking at it, or Obamacare. It has really narrowed the market and made restrictions on the market even more. But most patients who have insurance will go online to United Healthcare or Blue Cross or Aetna, Cigna. Those are the main providers, and see who takes their insurance. But then even still, those lists are not always perfectly up to date. So you have to call and check to see if we accept that as a form of payment or not. We see any patient, regardless, that we don't restrict them. They would have to pay for service if we don't accept their insurance as a form of payment. We still see anybody. But also when we have an insured patient, we have to make sure that when we refer somewhere, that provider
takes that insurance.
That orthopedist or cardiologist, or even MRI scanner. That's really important as well. So I think once you get in the pipeline, we can get it right for the patients that come. We see many foreign people who are here, Germany,
Right.
Canada.
That's right.
And so we have to assist them with their insurance needs,
Right.
their forms to fill out, et cetera, et cetera. And language can be an issue, but you don't need a lot of language to communicate.
No, you don't.
No, not
No,
really.
not really.
Not really. So it's always interesting to have Germans and French, and obviously we have people in the office who speak Spanish because there are many Latinos here. So that makes it much easier when you see a Latino speaker. But when it comes to languages that we don't often see, that's a little more difficult.
Right.
But it works.
Well, Greg, we're going to take another little short break, and we're going to be coming back, and we're going to talk about dialogue with the doctor.
Okay.
Okay.
We'll do that.
We'll be right back. Thank you.
Thinking of buying or selling a home in Naples, Marco, Bonita, or Estero, Florida? Think of the most experienced York Real Estate Group associated with the #1 brokerage in Naples, Downing Fry Realty, which produced $1.9 billion in sales in 2014, controlling 43% of all transactions in Naples. Jim, Michael, and Morgan York make up the York Real Estate Group of Downing Fry Realty. With over $250 million in sales transactions, they can offer you the expertise and trust you want and need in a realtor. Call them today at 239-273-6727 or visit their website, www.naplesyorkrealestate.com.
Welcome back. Dr. Leach, I know for about 8 years that you've been doing a show called Dialogue with the Doctor, and I know I've been involved in it a little bit. So I'd just like you to tell our viewers about Dialogue with the Doctor and how they can access it and what you do when you interview the doctors.
Well, interestingly, we're talking about how to access or find a physician. And
Right.
pardon me. Dialogue with a Doctor is one of those ways, actually. It is a show that I host and actually that you produce
That's
and,
right.
and started, thanks for all the work that you have done and still continue to do. We interview physicians, usually specialists, and discuss what they do for a living, and generally what they do for a living.
Mm-hmm.
And then also talk about some of the educational needs that patients have, whether it be about gastroesophageal reflux disease,
That's right.
or radiation oncology, urology for women, men.
Right.
We've done it all, and much of that is education. So it's really a quick, 30-minute or less show for a patient to learn. But it's also a way that you can see, in that particular circumstance, the physician that you might even go see.
That's right. That's what I think. So that's important also.
Because
right?
you can see a picture online, you can read all the stuff in the world, but there's nothing like face-to-face, FaceTime, and when you see the provider, the physician talking. I was going to say providers, we're labeled as entities now, but we're people, doctors.
That's right.
So you can see what they're like, you can see their personality, you can actually see how they communicate, how well they communicate, and that's really important. So even talking about just those educational things that they talk about, but also they go in depth on some of the more cutting edge treatments that they're doing.
Yep.
And there are many cutting edge treatments that are here in Naples.
It's surprising. So
It is. I always joke with my patients that Naples is a hick town. By numbers, it's a joke. It's obviously not a hick town, but by numbers, it's small. But
Right.
because we have so many people coming and going internationally and within the United States, we have the opportunity to have a higher volume of
Right.
patients coming in. And medical tourism, which is a term that where patients will come and have a procedure or a therapy done. For example, radiation oncology for prostate cancer.
Mm-hmm.
It's very streamlined these days and relatively speaking hassle-free. It starts and it ends over a relatively short period of time.
Right.
Somebody can come on, well, that's not quite a vacation, but and stay in a hotel or stay somewhere and have their treatment done, not have to run back and forth to work and then leave. So there's a lot of, and because of the volume driven, we can afford, or the providers can afford to have the technology to service those patients. We also have people coming from South America coming here specifically for that. So patients are coming from all directions.
Yep, they are.
And they're also, I'm sorry?
No, that's okay.
There's much research protocols being done here, many research protocols in all of those specialties we talked about. So there's one currently now on interferon use for hepatitis C virus, which is definitely cutting edge. I apologize, not interferon use, but interferon used to be what in the beginning was used. Now there's multiple drugs and several generations ahead where we have medications that are much more friendly to the patient, less side effects, et cetera, doing research on that in hepatitis C. So patients want to get in on that, have that opportunity to
That's right.
to do that.
And they can learn all about that a lot on the show that you
Yes.
do, because you are speaking to doctors about things that are cutting edge that maybe we wouldn't know about. So.
Yes, and I learn from the show quite a bit,
right.
and I try to make the questions patient-oriented. Sometimes because all doctors are science nerds
Right.
at heart, you start talking science and you can get carried away. So we try to bring it back in balance, which you've always helped me to do,
Right.
to get the right questions. So.
Well, we're going to be launching that website in January, and people can go to it. It's going to be www.dialoguewiththedoctor, DIALOGUEWETHADR@cs.com. No, .com.
.com.
Not
.com,
CS.
yeah.
So that
Spelled
was
just like dialogue with a
That's
doctor,
right.
with a DR.
Yeah, and it'll be on
.com.
our monitor here too.
Yeah.
So,
And the website it's really cool. It's exciting because it has many of the shows that we've done
that's right.
over the last. This will be our eighth season of doing the show coming up, and all of those educational shows can be accessed through the website.
That's right. They can.
Also, the providers, the physicians that have been on our show,
Right, they're featured there too.
their biographies are there. So it's a very good website.
It's very exciting. It's something that people can go to and at their leisure and one place and see all different specialties and meet the doctor through our show. Well, Dr. Leach, I appreciate you coming. I know we've known each other for quite a while, and again, I think you're the best guy in town. So
I try to be.
And so thank you for
Thank
coming.
you. I appreciate it. It was good to be here.
Yeah, thank you.